Hi, my name is Dr. Malini Narayanan, and I'm a board-certified neurosurgeon, brain and spine. And I just wanted to go through a very superficial explanation of a craniotomy. I often do what's called a craniotomy, which is a surgical procedure to gain access to the brain. We often have to have access to the brain for many reasons. There can be a head bleed that has to be evacuated in order to save the patient's life. There can be a brain tumor that's causing serious symptoms that is benign, such as a meningioma that we need to remove. There may be a cancerous brain lesion from metastatic brain cancer or primary brain cancer, that is the cancer coming from the brain, that we need to also remove in order to save the patient's life. This does not go into the brain anatomy, but it does kind of give a basic description of a craniotomy. And basically, to remove the bone of the head under which the brain exists. Amazingly, the surface anatomy of the skull is tremendous. One can spend years studying it. This is going to be very cursory, but in the skull, we have the frontal bone, we have the parietal bone, we have the occipital bone, and we have the temporal bone. Each of these bones are separated by various what's called suture lines, which developmentally these bones came together, and when they came together, there's a suture line separating these different kinds of bones. Each suture line actually has a name. When we're talking about where to remove the bone, it has to do with where the lesion is. If the lesion is in the front, then we need to do a frontal craniotomy. And that may mean making a skin incision across, having the skin come down above the eyes, and removing this bone with a drill, a specialized drill that creates little holes in the bone, connecting these holes with what's called a craniotomy, or in other words, a foot plate that you hook under the bone, bring it across, and create a piece of bone that can then be removed. After we do our surgery to remove the frontal lesion, then we replace the bone and secure it with plates and screws, and it stays in place, and oftentimes the bone or scar tissue will heal along the crevices. If the lesion is in the parietal bone, then we would do the craniotomy in this area to remove the bone and remove the lesion, either in the brain, underneath the bone, a bleed surfacing the brain, depending on the lesion. But if the location is under here, then this is the bone we would have to remove. A very good anatomy knowledge is needed to understand where the cuts are safe to make, so that this initial procedure goes very smoothly, and we go then deeper into where the main problem is. And that's it for a simple review of a craniotomy. Thank you very much.